Welcome to another edition of C3 Coaching from the Johnson Rosa. My name is Kenneth, and I am a certified health and wellness coach with a specialty in chronic pain management coaching, however you want to say that. I'm also a certified mental health coach, and I am glad that you are joining me today. Today's topic I am very excited about. It's very personal to me because of experiences within my life, both with myself and family members, but also because it's what I have learned over the last 3 or so years has really been a game changer for me in the realm of my own chronic pain and how to relate to other people. Hopefully, how to be a better helper and offer hope to other people as well in my coaching capacity. But I'm really looking forward to this one. This is going to be a lot of information. It's going to be a general overview. So it's going to be a lot of stuff that I'm not going to be able to get into. I'm just going to give some brief highlights, but it's still going to be a lot of information. I'm going to try and not overwhelm you with a lot of my personal views on it. There's going to be one part of this episode that we're going to talk about that I do have my what we would call my soapbox feelings on that. So I'm going to try and avoid that as much as possible, but I'm also going to try and not shy away from why I feel the way I feel, but I don't want to be a turnoff for anybody as well. So I'm going to go ahead and pull up the slides. We're just going to get into the topic. And like I said, I'm going to try and keep this about 30 minutes. Just give you some information, hopefully give you some help, some resources, and be a hope for you that are experiencing chronic pain. Know that I've been right there, gone through my own health issues over the last 20 some years. So I'm not just trying to give you some information, not trying to sell you anything, but just want to let you know that these things have helped me to understand these things, and hopefully it's going to help you as well. So let's get the screen started. There we go. Okay. So just some information before we get started. This is how you can contact us and keep up with what we've got going on. I'm pretty active on Facebook. It's really the only social media that I'm doing right now. I am planning on getting on some of the other ones, but right now it's just Facebook. This is where you're going to find these videos. We're going to be uploading them to our Facebook page, which is C3 Coaching from the Johnson Rosa, and also going to be uploading them to our YouTube channel, which is Johnson Rosa Homestead. You can always send me an email as well. That's johnsonrosahomestead@gmail.com. And let us know any questions that you have if you're looking for a coaching session. I do offer a free coaching session, which is about 30 minutes long. It's an introductory session. I get to know you, you get to know me and the coaching process, and then we'll go from there. All of my coaching is done through Zoom. So I would send you a link, and then we'll schedule a time and do a coaching session with you. But again, this is our contact information: Facebook, C3 Coaching from the Johnson Rosa. YouTube channel is going to be Johnson Rosa Homestead, and then the email address again is going to be johnsonrosahomestead@gmail.com. So again, we're just going to go ahead and get into this topic, but we're going to do a disclaimer first. And especially with the topic that we're going to talk about today, I want to make sure that this disclaimer gets out there. So this video is for information purposes only. I am not a medical doctor, therefore I do not diagnose nor prescribe treatment. Please seek the advice from a qualified medical professional before discontinuing a medical treatment or starting a new one. The last video that we did, or the introductory video that we did on coaching and what it is. So as a coach, I'm not a medical provider. I do not diagnose anything, and I do not prescribe any treatment plans. What I do is I come alongside of the client we collaborate together, a plan, a vision, goals that the client can realistically do in order to achieve what it is that this client wants to do in their lives, whether it's they want to get better sleep, they want to come off of certain medications, they want to get more active, whatever it is. This is what my role as a coach is to help you formulate a plan and then step by step, process by process, meet some measurable goals, some time frame goals, and the end result would be that that client is bettering themselves, they're empowering themselves, they're growing as a person, that they're getting more joy in their lives, they're getting more involvement in their lives and so forth. So that's what the coaching process is. So I just wanted to give out this disclaimer that as we go through these slides, we go through this presentation, especially when we get to one section of what we're going to be talking about, that's going to be my soapbox area. That's going to be my opinion, and I'm very opinionated on that particular issue. So again, this is just for information purposes. If you'd like to get into the coaching process and as a client, then reach out to me. And again, we can schedule a time and start that process. But this disclaimer is out here just to let you know that I'm not a physician. I'm not a therapist. Even though I'm a certified mental health coach, I'm not a therapist. I'm not going to prescribe any medications to you or anything like that. Again, the coach is here as a collaborator to work with you so that you can achieve goals, lifestyle changes, whatever it is that you want to make. I'm just here as a helper and to offer hope to you. So our topic today is going to be chronic pain, the mind-body connection, and opioids. A lot to cover within, a 30-minute or so time frame. So we're going to be hitting some highlights, doing a bird's eye view on a lot of this, and then just going on. I'm going to offer some resources at the end so that you can dive in and get more information from the professionals that are looking at this mind-body connection. And then from there, you can dive in even deeper than that to learn as much as you can. It can be overwhelming, so take bite-sized chunks, digest those. Once you understand that part, go back in, grab some more from the buffet, and just keep on going. Question things. Be a learner. Be open to new information. As a chronic pain patient, I don't want to use the word suffer, but as one who has experienced chronic pain for 20 plus years, a lot has changed over those 20 plus years in what scientists understand concerning chronic pain and how it's connected from the brain to the body and so forth. And again, we're just going to hit some high spots and keep on going. So let's start off with chronic pain. You and I, who have experienced chronic pain, we know it's real. We know it because we feel it. We know the effects of chronic pain. It's draining on us emotionally, mentally, physically, and socially, and to a point, it can be spiritually. And it's also debilitating. I know of and have heard about so many people because of their chronic pain, they don't get out of the bed. Or if they do get out of the bed, they go from the bed to the couch or the bed to the recliner. And that's pretty much their lives because chronic pain has so debilitated them that that's their life. And it's a sad way to live life. But I know that so many chronic pain people who are experiencing chronic pain, that's where you're at. You feel like there is no hope. This is what it is. This is your life. And I'm here to tell you that that does not have to be your life. I'm not ever going to tell somebody, and I don't even tell myself this with what I understand and what I know. You should not expect to be pain free, but you should and you can expect to be living life to the fullest extent possible in spite of and while living with chronic pain or living in pain. The way that we look at it is, and we have a perception of chronic pain that causes us to think one way, and it limits us to the bed, it limits us to the couch, it limits us to the recliner, and it's a lot of it's fear-based. If I move, this pain's going to increase. If I move, it's going to cause more physical damage. So we, because of this fear, and I'm not shaming anybody, I'm not guilting anybody, I understand it, but because of that fear, it restricts us. So I want to offer you some hope today that you don't have to live in fear. And the reason why we don't have to live in fear is because of what science is helping us to understand about the mind-body connection. The mind-body connection is how we respond to the danger signals, the pain signals. It's how we react to life. And it's very important that we at least get a basic understanding of the mind-body connection. Within the mind-body connection, there's this understanding or this reality of what acute pain is contrasted to chronic pain. Acute pain is, it's in the moment. You've got an injury, you broke a limb, you've lost a limb, you were in a car accident, you had surgery, the different aspects of that. So that's acute pain. And acute pain usually subsides within a period of time of a couple of days, a few weeks, possibly a few months. Most people would say up to between 3 and 6 months is when acute pain should go away. If that pain continues longer than that period of time of 3 to 6 months is usually what they're saying, that it goes into that category of what the doctors and the scientists say is a chronic pain. So chronic pain just basically means it's ongoing pain. It has not subsided. It has not gone away after the time period that the tissue damage, the broken bone, whatever it is, has healed as much as it's going to heal. So then you continue with what they consider chronic pain. Where does pain originate? Our first initial answer is going to be where it hurts. You stump your toe, that's where the pain originates. You have a bulging disc in your lower back, that's where the pain originates. You pull a muscle, that's where the pain originates. You break a limb, that's where the pain originates. And the reality is that the pain originates in our brain. The brain is what causes us to respond in pain. So we've got all of these these receptors throughout our bodies. I mean, everywhere. Your hair follicles have receptors. Your skin has receptors. Your fingernails have receptors. Receptors everywhere, and there's different types of receptors. And one of those receptors is what they call a danger receptor. So peripheral area, you have a hair that's plucked out, you get a signal that's sent to the brain, and the brain determines whether that's something that the body needs to be concerned about. If it is, then it sends a danger signal in the form of pain. So all pain originates within the brain. There's been tests and research, years of tests and research that now prove that pain comes from the brain. So you got that pain-brain concept, that mind-body connection. It's hard for us to fully understand it because where I feel the pain, I scratched myself yesterday doing something outside and started to bleed. And the moment that I hit it, I felt the pain, I saw the blood, but today there's no pain there. So that would be acute pain. But my brain sent the response from the signals that were sent to it from my arm. Hopefully that makes sense. But all pain originates in the brain because it is a response to the signals that are being sent to the brain, up the spinal canal, up the spinal cord, from the nerves into the brain, and then the brain is processing it and sending back a response. There's a biopsychosocial spiritual impact from pain perception, especially in the realm of chronic pain. It affects us in area of our lives, and it's a sad way for us to live. But the more that we understand our own chronic pain, the more empowered we are to treat our chronic pain, and we don't have to rely so much on the medical establishment, which is a good thing. The more tools we have, the more resources we have to take control of our lives, the more we're not dependent upon somebody else. I personally don't want to be dependent on people no more than I have to. And I'm sure that the majority of y'all like that as well. You don't want to be dependent upon medication. You don't want to be dependent upon external treatments. You don't want to be dependent upon even our spouses. We don't want to put them in a situation where they have to take care of us, even though we ask our spouses, hopefully the majority of them is going to say, I love you, and this is the reason why I'm taking care of you. But we don't want to be a burden on them. So the more that we can empower ourselves with resources to take care of ourselves, the better off we're going to be. So chronic pain is always, or pain in general is always originating from the brain. But the medical establishment is trying to treat chronic pain based upon what we feel. So I go into the doctor's office. They ask us how we're doing. What's our pain level on a scale from 1 to 10? You look at these little faces and where are you at? Are you sad? Are you happy? Are you in between? Are you angry? Or whatever it is. So we tell the medical professionals how we feel, the pain level that we have, and based upon what we tell them, and they look at MRIs, CT scans, myelograms, X-rays. They do manual tests on you and so forth, range of motion, all of that. But at the end of the day, they're going to prescribe treatment based upon how much pain we say we have. Opioids come into play because they can relieve the pain. The failure of opioids is that the original intent and the original function of pharmaceuticals was for acute pain in the moment, to give the body time to rest, recover, and to heal. Once that rest, recovery, healing process is done, again, that period of up to 3 to 6 months, after that, your body's pretty much done all that it's going to be doing in that healing process. So the pharmaceuticals have helped you up to that point, and they really can't do any more for you except for to numb these sensations that we have. But the sad reality of medications is that only about 58% of chronic pain sufferers patients have relief based upon opioid usage. So based upon a WebMD research, I guess it was a poll or survey or something, only about 58% of chronic pain patients were being relieved with opioids, with medications. And the number is actually lower. It's probably around 30% range. So the opioids aren't even doing what medical establishments, pharmaceutical companies are telling us that they're supposed to be doing. What opioids are doing is they're getting people addicted to opioids, and they're causing all of these side effects: physically, emotionally, mentally, spiritually, socially, the devastation that happens with opioid usage. We can use them as prescribed, but you're still going to have effects on you in those areas of life, of our lives. The reality is that most people who use opioids do not use them as prescribed, because the opioids don't, on a continuous basis, give you the same relief, the same euphoria. I hate to use the word high, but it is a high because of the opioid receptors in our brains. It is a high. So the opioids don't consistently give you the same effects as they did when you first started taking them. That's why a lot of times when you go back to pain management, you go back to the doctors, they increase the dosage, they increase the frequency of taking the medications, and a lot of times they start to combine the medications to try and maintain that feeling that you had when you first started taking these medications. And the whole time that you're taking these opioids, and the whole time that you're increasing the amount of usage and the time expanse that you're taking them, is wreaking havoc on your physical body, on your brain, on your mind, on your emotions. Spiritually, we have these questions that come in our minds concerning our relationship with God, why we're going through what we're going through. Socially, we don't really want people to know what we're taking. We feel guilty because of the chronic pain, because of the opioid, the impact of the opioids. They make you sleepy, they make you foggy in the mind, so you really don't want to interact with people, and you feel guilty because you're not interacting with other people. Again, just all of the side effects that come with opioids. And again, disclaimer, I'm on my soapbox on that because of what I've seen family members experience with opioid usage. And I thank God that what I saw them go through made me afraid of opioids, to the point where when I've had my surgeries in the past, I would take the opioids for a few days, maybe a week. And then after that, I came off of the opioids. I took the, over the counter Tylenol, Advil, ibuprofen, um, alternatives, whether it was CBD salve, tinctures, essential oils, whatever it is that I could take to prevent me from having to take the opioids. That's what I did. So I am afraid of opioids. I admit that. Addiction runs in my family. This is one of the next bullet points that we have on here. So I am afraid of them. And if you have to take opioids, just be real careful with them. And I would encourage you to have a game plan to get off of the opioids, which is where coaching would come in to help you find other resources that would, again, help you to manage your pain and still live a functional life, but don't have the expectation. And I think that's what opioids has sold people, is that you'll be chronic pain free. And in reality, you won't be able to function in your life as good as if you were just managing the pain instead of having the expectation of being chronic pain free. So the opioid receptors, these manufactured opioids are filling that void. They're going in, and your brain is being stimulated in a certain way. That's where addiction comes in. If you're being stimulated in a certain way for a certain amount of time, most people become addicted to it. And then you have all of the repercussions of addiction, trying to come off of whatever it is that you are addicted to, trying to come off of that, the side effects of coming off of medications, coming off of drugs, coming off of alcohol, coming off of whatever the stimulant is, whether it's pornography, cell phone usage, social media. This can be an addiction. Whatever it is, when we try and come off of what it is that we're addicted to, there's going to be repercussions to that. And we have to be prepared to take that into consideration when we're making a decision to have a life change and to better ourselves, whatever the addiction is. The effects of opioid usage on a person's, again, I talked about this, the biopsychosocial, spiritual aspect of the health and wellness. It affects everything. Opioid usage does, alcohol usage does, smoking cigarettes does, too much sugar in your life, eating unhealthy foods, it all affects us. You can't avoid it. You can say, well, what I eat doesn't affect how I think. Yes, it does. What I eat doesn't affect how I interact with other people. Yes, it does. What I eat doesn't affect my spiritual concepts. It does. You can't avoid these areas of your life. You can't think that, well, what I do in this one area of my life doesn't have effects on the other areas of my life. It does, and especially with opioid usage. Netflix came out with two mini series that me and my wife watched over the last week or so. One of them was Painkiller, and the other one was The Pharmacist, and they're pretty good. I know Netflix can do a lot of exaggeration in some of their what they call documentaries and so forth, but overall, it had a lot of truth into it. A disclaimer on both of them: they did have some language in them. They did have some scenes that I, as a Christian, wouldn't recommend. But for informational purposes, I thought they were really good, and they do tie into opioids and chronic pain and the situation that we're finding ourselves in with the addiction rate and the fallout from opioid usage. I do have some recommendations. Two very short videos that go back to the mind-body concept, not necessarily with chronic pain, but just with the mind-body concept and how it works together. One of them is Tame the Beast. It's a 5-minute video on YouTube by Lorimer Mosley. The other one is Persistent Pain Explained in 3 Minutes, and that's by Adrian Liu. Again, just go to YouTube and Google search them or YouTube search them. It'll pull them straight up, and then you can watch them. So 8 minutes of your life will give you some very decent understanding of the mind-body connection, and also what is known as the Pain Neuroscience Education. Again, about 3 or so years ago, I came across this, started looking into it. My health and wellness coaching certification, the classes, and then the advanced pain management classes as well, majored on pain neuroscience education. When I started understanding that and how it relates to my own chronic pain, it was just an eye opener. It was a game changer. So take 8 minutes, watch both of these videos, and just gain some information. Information is power. Again, as we close out this session, this is our contact information. You're probably watching this video from either our Facebook page or our YouTube channel, but our Facebook page is C3 Coaching from the John Serosa. This YouTube channel is John Serosa Homestead, and then contact me by email if you want to. It's johnserosahomestead@gmail.com. Make sure that you're following us on Facebook. Make sure that you're subscribing to our YouTube channel. That way, if it's not a video, I'm still interacting on Facebook, giving updates, giving information on different aspects of health and wellness coaching, different aspects of chronic pain coaching, different aspects of mental health coaching, different topics that we're going to be covering in these videos. I felt like this one was very important because it lays a foundation of the reality of chronic pain. So chronic pain, again, just want to stress that it's real. What we feel as chronic pain patients, it's real. It's subjective though. So nobody can tell me that when I'm having a flare up that it's just in my mind. The brain body connection is not about imagination. You're conjuring up something. It's your brain actually sending signals down or responses down to the peripheral areas of our bodies and saying that it is a pain. Be careful with it. It's a danger. You're unsafe. But the reality of it is, with chronic pain, the majority of the time, it's not that it's unsafe. It's not that it's a danger. It's not that it's going to harm us in any way, but it's because of something that's happened in our past that our brain still looks at that as it's still present tense. It's still a reality. We need to be concerned about it. And it takes time to reprogram our brains. We're complicated creations, and our brain is the most complicated organ within this human body. So it takes a while for us to readjust things. It's just like learning a foreign language. It takes time. It's just like trying to change your eating habits. It takes time. And it takes trials. I don't like to say errors, but it takes trials and learning and continually processing, continually walking down that journey. So those of us who are suffering with chronic pain know that there is hope. You do have help. Your pain is real, but you don't have to be defined by this pain that you're living with. You don't have to be confined to a bed. You don't have to be confined to your house. There is hope. There is help. There are resources that can give you back a reasonable quality of life. Again, the expectation is that I'm not going to be pain free, but I'm going to be able to live my life to the best of my abilities with the resources that I've gained so that the pain does not consume me so much. So I just want to offer that help and that hope to you as a coach. If you'd like to have a coaching session, reach out to me through Facebook Messenger, through email. We'll schedule a Zoom meeting and walk with you through that journey, through that process. Let me get this off the screen share. There we go. So we're going to close out this session. Hopefully this has been, again, just a broad overview of information. Check out those 2 videos that I recommended to you. That's 8 minutes of your life that I do not believe will be a waste of your time. I think it's going to really be an eye-opener for some of you, maybe to reinforce some concepts that some of you already understand. Again, that mind-body connection, that pain neuroscience education aspect of understanding chronic pain. So yeah, contact me. Let me know what you thought about this video. Got any questions? Send me some questions. Again, if you want to schedule a coaching session, reach out to me through our Facebook page, C3 Coaching from the John Serosa, or shoot me an email at johnserosahomestead@gmail.com. Appreciate your time. Hope you'll continue to walk with us on this journey. We're going to have some more topics coming up and a lot of learning in my life, and what I learned, I want to give to you, and hopefully it's going to be an encouragement and a help to you as well. So trying to enjoy the rest of your day. Know that there's hope, know that there's help, know that you're not alone, and it'll get better. Y'all take care.